How much sleep is enough sleep? Is it 7 hours or 8 or even more? And beyond the length of sleep, is it also not the breadth or the quality of sleep that matters? So I haven't slept for one night. Is that insomnia? Or does there need to be a pattern? Perhaps insomnia is the most common amongst of sleep disorders. But then what are sleep disorders? They probably are the most common afflictions of modern lifestyles. Hello, all. Welcome to our podcast, The Prescription on Earshot Media. I am your host, Dr. Karan Thakur. I hope you're all safe and sound. In this episode, we'll be joined once again by Dr. Viny Kantroo, Senior Consultant, Respiratory Medicine and Sleep Medicine at Indraprastha Apollo Hospitals. We will be discussing about sleep disorders and more.
Indraprastha Apollo Hospitals presents The Prescription in association with Earshot.in.
So, Dr. Viny, welcome back to our podcast.
Thank you so much, Dr. Karan, for calling me here on this podium.
It was wonderful to have you the last time around when we discussed flu, and we have another vexing issue to discuss. All of us have struggled and battled with insomnia at some stage in our life or are still struggling with it. And that's why we thought we'd cover it in this episode. So let's dive right in. So, Dr. Viny, what is insomnia?
Right. As you rightly said, insomnia is really common, and it is one of the most common conditions for which people seek medical help, because being not able to sleep is not easy. And insomnia is something when you have inability to sleep at a particular time for a particular duration as you desire for it. So sleep is a very complex phenomenon. Many factors go into it. You need to be very relaxed. You need to be having a perfect medical condition for sleep to come into your system and bless you with that soothing feeling which we all get after we go to sleep. So it's as complex as it gets, but it's as simple for people who really get it. So I would say people who do not get sleep really know the importance of not being able to be sleeping for hours, for days, or for months together.
Right. So, as you said, I mean, those who don't get enough of it realize the importance of it. So, what contributes towards this lack of sleep? Why does it happen?
So again, there are a lot of factors which contribute for not being able to sleep. Now, these can be acute factors or they could be chronic factors. Some part of our life, we even have ourselves met with a condition where we are not able to sleep for days or weeks together. Now, once we are not able to sleep for a shorter duration of time, which includes weeks and months, and there are certain triggering factors, there are certain factors in our life which trigger this kind of situation when we are not getting the sleep. Then those triggering factors could be related to medical health or the physical well-being, which by which I mean a perfectly healthy body. Or it could be, on the other hand, some kind of mental issues going on acutely, which trigger the stress out there inside of you, and you are not able to sleep. For example, in the lockdown period, a lot of us have lost our usual jobs. People have been affected economically as well as socially. But I should stress upon the fact that medical conditions which include having increased nocturnal, nocturia, not being able to pass enough of urine, you have to get up again and again during the night, for example, or you have certain breathing difficulties, you have certain chronic pain which could be interfering with your sleep pattern. So these are certain medical conditions which need to be ruled out, especially when we go into the workup of sleep patterns and people having insomnia.
Right. So, it is an incredibly complex phenomena, sleep by itself. And there are a lot of contributing factors that can disrupt sleep. And some of these you pointed out to, many of those that you pointed out to, are also within our control or modifiable. So, does diet or our lifestyle or an erratic diet or some medications impact your sleep?
Yes, definitely, of course. In addition to erratic diet and eating certain kind of oily foods, heavy food stuff late into the night, and then going on to the bed could interfere with your sleep, which causes certain amount of gastric irritation, as well as GERD, which is known as gastroesophageal reflux disease. You have reflux happening from the stomach, the small amount of acid which is happening there and irritating your throat is interfering with your sleep is one of the things. Along with it, I would like to say that in fact there could be certain factors. For example, thyroid could be coming into play. When your thyroid is not in place, you are hyperthyroid, you need medications to control them. That could be interfering with your sleep, not being able to sleep. And also, for example, certain kind of infections, for example, having a urine infection which causes increased amount of nocturia in the night, those could be certain triggering factors, as well as our erratic sleep patterns per se. For example, in the younger generation, when we were young, our sleep pattern used to be very erratic. Studying late into the night, not being able to cover your syllabus once you have exams, then getting up late in the morning, not having a regular routine, having excessive caffeine per se, especially during the late hours or evenings, having excessive alcohol also, or smoking per se can interfere with your sleep pattern. So these are something which are put together into a term which is called as sleep hygiene. So you have to have a good sleep hygiene to be able to sleep better. This includes your weight management as well. When somebody is very obese, once they go to sleep, they have a lot of gastric reflux happening. They have weight which is interfering with their breathing. When people sleep flat, their lungs per se, the size of the lungs goes down, and body has to overwork when they are on the obese side. So these factors do play their role in a large extent. So these are something which are called the modifiable factors. These could be modified with your lifestyle changes. So these are the factors which are really important to give you a good sleep overnight.
Just the thought of not being able to complete your syllabus has brought back some unpleasant memories, I think. And, I totally agree with you that some of these lifestyle factors play an important role. But is there something non modifiable, like, say, age, that can also play a role in insomnia?
Definitely so. Yes, there are certain non modifiable risk factors which could be as simple as genetic predisposition. As we spoke of metabolic syndrome, now metabolic syndrome includes obesity, it includes hypertension, having central obesity, your central waist to hip ratio is more, and having a predisposition to having diabetes, which is a metabolic syndrome, does have a genetic component in common. Now, if it is associated with something which is called obstructive sleep apnea, because your neck size is shorter because of the genes which you carry. So these are certain factors which could be non-modifiable, because these kind of disorders secrete certain kind of hormones inside of our brain which are called as neurotransmitters. Now, neurotransmitters do play their role in keeping our brain awake during the day and signaling the brain properly during the night time when the light goes down to go into a restful sleep. So there is a complex interplay between the genetic and the environmental factors which comes into play when your body is put to sleep. So genetic factors is one of the things which is non-modifiable, and as you rightly said, there are certain non-modifiable factors which could be catered to with the help of machines which are called as CPAP machines, as we prescribe in obstructive sleep apnea. Also, there could be medical conditions which cannot be cured, which do not have cure per se. This includes certain kind of syndromes, which includes the Prader-Willi syndrome. So this is common in the younger age, in the childhood, and easily picked up when you go to your doctor.
Right. So you spoke about sleep apnea, and I think that's One condition which, I mean, insomnia, a lot of people talk about it because of its prevalence probably being higher, but sleep apnea is also a very issue of concern, and it's a major problem. And it's basically irregular breathing at night, and that could be because of the anatomical factors or some non-modifiable factors, like you said. But essentially, what is sleep apnea?
Right. So sleep apnea is when your upper airway is getting collapsed during the night, because when we sleep and go to sleep during the night, the muscles they go into a restful condition and their tone goes down. So your trachea, which is the breathing tube, is not kept in a tented position, which means that it is not open enough to let air inside of your lungs and let the oxygen exchange take place, so that your brain is adequately oxygenated as well as your heart works properly during the night. So once your brain doesn't get that adequate amount of oxygen, the body kind of triggers certain neurotransmitters in the brain, which causes arousals, frequent arousals in the night. So, usually in these patients, snoring is very common. So, most of the time, the person who has this condition may not be able to point out what exactly happens to them, but they often tell you that they are not able to go to deep sleep, and they're often excessively sleepy during the daytime. So it is their sleep partner or bed partner who would tell you that they have frequent apneic episodes, which means the cessation of breathing, which happens after a loud snoring, and they have to get up to take a deep breath to get adequate amount of oxygen inside of their body. So this is something which is called as obstructive sleep apnea, which in simple language means your breathing tubes are getting obstructed and your brain is not getting enough oxygen to pump into your body. Hence, there is frequent arousals in the night. The person doesn't go into deep sleep. So during the day, they feel very lethargic. They feel sleepy all the time, and they say that we haven't had any restful sleep. So that is what is obstructive sleep apnea.
So you mentioned that there's actually a cessation of breathing, even if it is transient or for a very short time. That's a very serious issue to have, isn't it? Night after night.
Yes, definitely. Night after night, weeks after weeks, months after months, because this condition is often ignored by the patient, by the caregiver, by their partner, as well as per se by the healthcare personnel also initially, because it is not very easy to pick up. The patient may not complain of very big things. They just say they are lethargic. That may be contributed to certain other factors. For example, having excessive work during the daytime, or blaming it onto your routine work, which you think is taking a toll on your health. So, this condition is often ignored for the first part of the year, except when people are well versed with these conditions. So, that is why we are trying to create this awareness amongst the people. If they have this condition, they should at once go to their medical health care givers and get themselves tested, because in the long term, it does have very bad effects, including weight gain, not being able to concentrate in your job, not being able to solve mathematical conditions and complex problems, and having certain heart conditions, which includes arrhythmia as well as CHF, which means congestive heart failure. Chronically, when the heart muscle has to overwork against the low oxygen in the body, it has to kind of push the blood at some part of a resistance, because your blood is not well oxygenated. So chronically, the heart has to go into a condition where the walls of the heart get thickened, their muscles get hypertrophied, and to a stage when the heart goes into a condition which is called as failure, which is congestive heart failure. So
Right.
in the long run, it is very detrimental for that person. And these obstructive sleep apneas could, in the later part of the time, go into something called which is central sleep apnea. So a person could be having a mixed disorder per se when they have these kind of problems.
Right. And the predilection for this is mostly towards men, is it?
Yes, that may be the reason, because men uh, as if you see by tradition or our value system, men are the ones who are the so to say, the breadwinners of the
Earners, yeah,
family
yeah,
or
yeah.
bread earners of the family. So they go out most of the time. And unfortunately, I would like to say that even the mother is more concerned about the male child in their family. Females often get ignored in this part of the world. But yes, men are predisposed because they have more tendency to go into something called metabolic syndrome. But this could be the fact that we are not picking up the females per se early on in the disease. But yes, men are picked up early, and they are predisposed to having metabolic conditions more than the females.
And what are the other risk factors or other things that you would look at to diagnose sleep apnea?
Right. So the other risk factors which are there for obstructive sleep apnea include the fact that your family member has had it previously. So that would be the genetic factors which are at play. Weight gain is a very big risk factor. Once you gain weight, there is a lot of fat outside of your body as well as outside of your neck. So the body has to overwork. It has to gain enough of oxygen to be able to push into your muscles during the night. And the other factors are having congestive heart failure per se. These patients are predisposed to having obstructive sleep apnea also. And also having thyroid conditions, which includes hypothyroidism, not having enough formation of thyroid hormones inside the body, does predispose a person for weight gain and having obstructive sleep apnea.
Right.
This also includes anatomical factors, which is something genetic. So somebody who has short neck, who has micrognathia, which means their chin is narrower, they are more predisposed to having this kind of condition. So
Right.
these things have to be looked into when we initially work up these patients.
Right. So I'd like to move on to something slightly scary, which is parasomnias, and they have a whole host of conditions that are associated with it: sleep terrors, sleepwalking, nightmare disorder, or even sleep paralysis. What are parasomnias, Dr. Vinny?
Right. So parasomnias are not that easy to explain. Parasomnias are something which are altered breathing patterns or altered movement disorders, which especially are seen in much younger age. So it is more common in children rather than adult patients. Yes, of
Okay.
course, it could get ignored in the initial part of its presentation, but yes, parasomnias are more common in children, which would be between 15 to 20%, as against 4% in the adult population. So
And why is that?
parasomnias, right.
Why is that?
So
I mean, is it?
this is a very complex phenomenon. There are certain genetic factors which predispose you to having parasomnias, and this could even include a person having sleep epilepsy. Hence, we need a very particular kind of history, a detailed history which goes into the picture, and multidisciplinary care, which includes the care by a neurologist and also certain amount of investigations, which could include EEG as well as MRIs. So we have to find out if there is any structural defect in the brain which is causing those kind of presentations per se. Having an abnormality in the temporal areas of the brain per se could lead to these kind of parasomnias. And if we find something treatable, which means that there is a structural defect in these areas of the brain, we could even go for the surgery and correction of these kind of phenomenon. But mostly it is seen that these are genetic factors, as well as people who have had certain traumatic disorders in the childhood. They have had traumatic experiences in their childhood. Unfortunately, they have lost their parents or seen something unusual in childhood. They are more prone to having it. Also, post-trauma stress disorder, which means people who have gone into the ICU, stayed there for long. They have had a particular kind of trauma where they were in a very bad condition and got treated for conditions like ARDS. These kind of patients do suffer from these kind of disorders, where these could be sleep related and they have had problems, including insomnia as well as parasomnias.
Right.
On the other hand, the reason could be simple. They could have just, restless legs, for which we have to rule out certain medical conditions, which includes vitamin deficiencies, as well as excluding any thyroid disorders.
Right.
So that is why I said this is a complex disorder, and the care has to be multidisciplinary, which
Yeah.
includes a pulmonologist, a sleep specialist, a neurologist, as well as a psychologist, and at some point of time, we might even include a psychiatrist into the picture,
Right.
because there could be certain amount of depression, anxiety disorder related conditions when these children have these kind of problems.
Right. So, very commonly we see that if you have insomnia, or if you're having a sleep disorder, or you've not slept well, there is a tendency to self-medicate, whether it is through pharmacological means, whether it is medication, sleep medication, or even things like alcohol, or even some teas that people take, herbal teas to, get a soothing feeling. How effective are they? How dangerous are they? What would you recommend?
Right. So, a person, when they have sleep disordered breathing, they need to understand they need to go on to a very healthy lifestyle, including sleep hygiene. Now, if they are taking alcohol late into the night and every day in their routine, so what happens? Alcohol is a depressant per se. Initially, it might lead to some amount of stimulation inside the brain, but per se, it is a depressant, and it decreases the tone of the muscles of your body. So often you would have yourself experienced also, when you drink excessively during the night, you tend to snore more. So that is because your muscles lose the tone, and you have these obstructive sleep apneas, which may be precipitated just because of excessive use of alcohol, especially during the evening time. So hence it is more important that you do not drink every day and drink in moderation. And also, drinking caffeine late during the night does cause certain amount of stimulation in the brain. You're not able to sleep at a particular time, your sleep patterns get affected, you remain awake during the night, tend to sleep during the day, and that causes a vicious circle where your work is affected as well. So these things need to be sorted. Along with it, I would like to reiterate that if you have certain kind of breathing difficulties happening, you have wheezing happening during the night, you have excessive nocturia, especially if you're more than 45 years of age. Now, certain disorders need to be ruled out, which include the prostatic disorders in men. They have nocturia because of prostate disorders. These can be easily taken care by the medication which is prescribed by a urologist, and once you are sufficiently tested for your prostate. Also, the thyroid needs to be looked into. If you have thyroid issues which is causing the sleep related problems, that might solve the problem to a large extent. But yes, self medication in the form of excessive sleep related medication, antidepressants, and certain psychiatric medications might actually interfere and interact with each other and cause increased problems. Hence, I stated very clearly that this is a multidisciplinary team approach which we have to follow after adequate amount of history taking, which is really, really important in these disorders, and examination of your nose, throat, your neck, your whole body per se, your BMI, as well as certain simple amount of investigations which includes your metabolic workup like your sugar levels, your ECG, your echo needs to be done to rule out these medical disorders. Also, sometimes when we see that patients have asthma, often they are unable to sleep because of the breathing difficulty which they have.
So our show is called The Prescription. So Dr. Vinny, what is your prescription for a good night's sleep?
Well, for a good night's sleep, you just need certain kind of sleep hygiene, which includes not having excessive amount of caffeine or excessive amount of alcohol, especially during the evening time and every day in your lifestyle. Also, please, if you're getting insomnia very frequently, you could be taking a walk after you have had your dinner, which should ideally be very light. So include a very good amount of antioxidants in your diet and go on to walk after you have had your dinner. Certain people also get soothing effect when they go for a warm shower before their sleep. So this could be practiced for a very good sleep. Weight management is really important because once you're obese, you do tend to have breathing difficulty during the night, especially for asthmatics. If they have breathing difficulty, which happens during the night, that hampers with their sleep. And taking inhalers at an appropriate time and as prescribed by their doctors is really important for these kind of patients. Also, please, if you're gaining weight and without any reason your diet has been consistent, please do check your thyroid levels also, which could contribute to you having increased weight and sleep disordered breathing. Also, if your partner is saying that you're having apneic spells during the night, you should at once go to your doctor and get yourself tested for sleep apnea.
Thank you, Dr. Viny, for coming onto this podcast, for keeping us awake with your fascinating insights.
Thank you so much, Dr. Karan, for calling me. As I told you, sleep is a very complex phenomenon, but if you include simple things in your daily routine and decrease the amount of stress and go on to a regular exercise regime, a lot of it could be sorted. Thank you.
That was Dr. Viny Kantroo from Indraprastha Apollo Hospitals, who joined us for this episode of The Prescription. Do encourage your friends and family to listen to our podcast on Earshot.in or the Earshot app. It helps our tribe grow. Till the next episode, stay happy and healthy.
Earshot, here and now.